Chapter 20 is on eating disorders, and we will just basically be focusing on anorexia and bulimia. Make sure that you understand pica. So first, anorexia nervosa. This is going to be an eating disorder that causes people to obsess over their weight and the food that they eat. People with anorexia, they attempt to maintain a weight that is far normal than what is normal for their age and height. They try to prevent weight gain, or they continue to lose weight. People with anorexia, they may starve themselves, and they may exercise excessively to maintain that lower weight level that they desire. So they exhibit just a morbid fear of obesity. They are just fearful that they're going to become obese, and they refuse to maintain that minimally normal body weight, which that means that they will have a body weight less than 85% of the expected normal weight for that patient. Also, with that 85%, less than 85% of the body weight, there has to be an absence of a physical cause. So that's basically means a disease such as cancer or something like that cannot be the cause of their weight loss. A person with anorexia, they can have many physical problems. There's some listed there on the box. Make sure you know those terminology: constipation, hair loss, lanugo on the body, bradycardia, electrolyte imbalances. Those are all big ones. So there are two different types of subgroups whenever we talk about anorexia. There is the restricting group. That is whenever the patient basically loses weight primarily through dieting, fasting, and exercise. And then there is the binge eating, purging subgroup. And not every person who purges is going to binge, but they may do both. So they don't have to have both of them, basically. They can do one or the other to fit within this category. So a patient with anorexia, they're often going to deny that they have a problem. And they're going to be very difficult to help due to this. They often feel like they're proud that they're able to control their eating and control their weight, and they don't see that their weight is at an unhealthy level. Anorexia can cause the hypokalemia due to the potassium loss from the purging or dehydration. The medical management, what our focus is going to be on, it's going to be on restoring the weight and correcting the electrolyte imbalances. So this is the primary concern. They may require TPN at first. If you do happen to have a patient that's anorexic and on TPN, you will notice that the TPN is going to be started at a low rate. And this is due to the risk of the refeeding syndrome that could occur. If they're able to eat meals, the meals are going to be planned out for them, and they're going to be full of nutrients and calorie intake. And it's going to start small, and then that intake will gradually increase as well, just like with the TPN. The TPN would gradually increase. Also remember that they're going to need to be supervised while they're eating, and for about 1 to 2 hours after eating. And they're also going to need to be supervised whenever they go to the bathroom to prevent them from purging the food that they just consumed. Medications, look over those medications, know them. They can be beneficial for patients with anorexia, and also therapy helps as well. So they will probably present with the physical appearance of starvation. Will be fatigued, they're going to wear loose clothing, and they won't want to acknowledge that they have a problem, because remember, they don't think that they have a problem. We can also see dental problems since they purge as well. if they purge. Your nursing interventions would just be to develop trust and develop that and maintain that therapeutic relationship and communication while monitoring their food intake, their exercise patterns, and any attempts of purging that they might have. So bulimia. A patient with bulimia, they present with weight that could be either normal, a little bit underweight, or overweight. Now remember, underweight, they're not going to be less than the 85% because that would be anorexia. So make sure you know the difference between that. They may be underweight, but they're not going to be severely underweight like they are with the anorexia. So bulimia is when a person secretly binges, which is eating large amounts of food over a short period of time and then tries to basically get rid of the calories by either purging or other mechanisms such as excessive exercise, misuse of laxative, diuretics, and or enemas. Between the binges, the patient will often eat low-calorie foods such as salads. Possible signs and symptoms of bulimia, dental cavities when they purge. They can have some calluses on their hands or fingers from the self-induced vomiting, muscle weakness, electrolyte imbalances from the vomiting, and laxative and or diuretic uses. So all those can cause electrolyte imbalances. A person with bulimia, they know that they have a problem and they often feel just ashamed and they will go to great lengths to hide it from everyone. So therefore, they're going to have difficulties with relationships due to this, quote unquote, secret life that they are living. So make sure you are always observing patients with bulimia after meals, just like with anorexia. And you'll also see that therapy for a patient that has an eating disorder is going to begin immediately after meals. And this is due to helping the patient process the anxiety that they have about the food that they just consumed. And it also prevents them from being able to be alone to purge the food. Read over this criteria for hospital admission. It is important for your test. Understand that slide there. Nursing interventions for eating disorders. Basically, you're just going to want to sit with the patients during meal and snack time and monitor them and continue to observe them for 1 to 2 hours after they eat as well. And if they are unable to eat their meal that was given to them, then you're going to need to provide them a liquid protein supplement shake. We're also going to need to weigh the patient daily and also just to help patient to identify their feelings that they have associated with their eating disorder as well. Read over that one. This comes from your ATI book, so get out that and read it. I do want to talk about the refeeding syndrome right here that we had kind of discussed about with anorexia just a minute ago. So refeeding syndrome. This can occur when a person is recovering from a period of basically starvation. So if a starving person is fed too aggressively, which means that they're fed too fast, it can cause this refeeding syndrome, which it's very dangerous and it can be fatal at times as well. So this refeeding syndrome is basically a result from intracellular electrolyte shift due to being fed too fast. So this is why a patient with anorexia is given little food to begin with, and then it will gradually increase with their meals. So little food to begin with, and then eventually they'll be giving more food or more TPN and have a gradual increase instead of all at once.